Welcome to today's webinar. I'm Ramsey Alwin, President and CEO of the National Council on Aging, and it is my pleasure to welcome you to today's discussion. This is the release of our second year of our groundbreaking What Women Say research. This is a joint effort of the National Council on Aging with the Women's Institute for a Secure Retirement, Public Opinion Strategies, and Lake Research Partners. We have all come together to raise up what women have to say about what it takes to age in America. Today's webinar will detail the very interesting highlights and findings from this second year of administering the survey. But before we dig in, we have a special surprise for you. We're thrilled to introduce Senator Amy Klobuchar of Minnesota. Senator Klobuchar is the first woman elected to represent the state of Minnesota in the Senate. She is the chair of the U.S. Senate Democratic Steering and Outreach Committee, as well as chair of the Judiciary Subcommittee on Competition Policy, Antitrust, and Consumer Rights, and the Committee on Rules and Administration. The senator's various other committee assignments also include the Committee on Agriculture, Nutrition, and Forestry, which means she'll be intensely involved in the Farm Bill discussions underway and any changes to the SNAP bill and other federal nutrition assistance programs. A long-standing strong consumer rights advocate, Senator Klobuchar introduced bipartisan legislation to lower prescription drug prices and has been a supporter of Medicare's right to negotiate lower drug prices with pharmaceutical companies. The senator also is an original co-sponsor of the Treat and Reduce Obesity Act, which would extend Medicare coverage to comprehensive obesity treatment. She is an advocate for caregiver supports and strengthening the elder care workforce, including introducing the Americans Giving Care to Elders Act. So impressive, and we are so appreciative of your leadership, Senator. Welcome, and thank you for joining us.
Well, thank you so much, Ramsey. Good morning, everyone. It is a sunny day in Washington, and I try to always look for the good, and we're hopeful. We have a lot on our plate right now, and one of the things that bothers me when we have all of these things going on that I think we shouldn't be focused on, I'm not going to go into details, and we get our eyes off what is really the elephant in the room, which is these healthcare issues, the long-term care issues, which includes, of course, healthcare. And so I am really, really impressed by the work the National Council on Aging and WISER is doing here with this really important release of the What Women Say survey. And I love, by the way, the simplicity of it. I love, like, it's just when you know that from, I'm not going to give everything away, but from a list of words, women age 25 plus selected uncertain, 54%, and worried, 47%, the most when asked how prepared they are for health costs later in life. And they tend to pick more negative than positive. And in a great country like ours, we should be able to turn that around. And it gives this, hearing this and knowing what I think we know intuitively when you look at the numbers and other things, but actually knowing where people are on this gives us the insight that we need to make the case for policies. Last year in this survey, I understand this time as well, have three major takeaways. Number one, the majority of women across all age groups are worried about their financial security. Duh, right? Number two, low-income women are most at risk of being unable to retire comfortably. And number three, and this is the good news, women across the political spectrum support policies to make it easier to retire with dignity. That's why I am so focused on making sure women have the fair pay and security they need to remain financially independent from their time in the workforce to long after they retire. I mean, we know what's going on here. There are women that go out of the workforce for periods of time to raise a family, then they have less in Social Security. They tend to live longer, which is a great thing, but that requires more resources while they have increasingly rising up in terms of salaries. They still make less than men in many instances. And then, you know, if they have issues come up in their life where they end up being the primary caregiver for parents and for kids at the same time, sandwich generation. I think of my own mom who worked as a teacher for a long, long time. And when I was born, they had a rule, which they no longer have, that you couldn't keep teaching when you were pregnant. And so they would hide it as long as they could, and then they'd have to quit. And so that's what she did. And she was a great mom. Then she went back to teaching when my parents got divorced. And I would always forever, she would talk about how the porch on the back of our house, which wasn't very big, was paid for with her retirement savings. She ended up teaching until she was 70. She had 30 second graders at age 70, in part, and she loved it, but I think she might have wanted to end a little earlier there, in part because she kept saying she had to still pay back, because that money from her retirement went to pay for the porch. So I kind of lived it on a daily basis, including some of the old cars she had and the like. And so it is not easy. And I think all of us know people or have stories within our own lives about how difficult this can be. Like the vast majority of the women that were surveyed, I believe strongly, my first lesson from all this is that we need to protect and strengthen Social Security. We know that Social Security is the foundation of a stable and secure retirement for millions of Americans, 55% of whom are women. There's our age gap as people get older, it gets more accentuated. Half of our seniors rely on Social Security for the majority of their income, and the program lifts more than 22 million Americans, including seniors, adults, and children, out of poverty. If you pay into Social Security your whole career, you should be able to get full benefits when you retire. That's why for a long time I fought against risky schemes that would privatize Social Security and turn it from a guarantee into a gamble, where the only sure winner are financial institutions. And to ensure future generations can get their hard-earned benefits, I'm pushing for sensible reforms to extend the solvency of Social Security. That's a lot of fancy talk for making sure that people get the benefits that they've earned. And there are ways we can do this without hurting people in their retirement, closing what we call the donut hole for when people have to pay in. So that helps everyone else. Now we know that's only one piece of the puzzle. As last year's survey showed, half of women ages 25 and up, and I think you're going to see that again this time, don't have an employer retirement plan. That's why I'm also focused on expanding access to retirement savings programs. I worked with my colleagues to pass bipartisan legislation that encourages small businesses to set up retirement plans for their employees, allows part-time workers to participate in workplace retirement plans, and changes the tax code to make saving for retirement easier. I'm also fighting for my bill, which Ramsey noted, to provide a tax credit for caregivers of aging relatives, an idea that was supported by 94% of women surveyed last year. If only they were all in the Senate. We had 94 of you that are on this call on the Senate, life might be easier. But in any case, that has got to be a priority as we see so many people that we may want to be in the workforce, at least part-time, that then they can't get caregivers. I think you all know there's also issues with finding workforce for some of these jobs, which is one of the reasons I'm such a strong supporter of apprenticeship programs and other things and incentives for people to go into areas like long-term care facilities, caregivers, nurses, doctors, anyone in healthcare. So that they actually, many of these jobs are good jobs. Some of them are really hard jobs, and we got to make sure they get paid right. And they also have the incentive for apprenticeships and the like. And not all of these jobs require 4-year college degrees. So I'm a big believer in these 1- and 2-year degrees and the like, as well as legal immigration reform, because no great nation has expanded with a shrinking workforce. We can try to be the first one, but that is part of the problem. The arguments and the work that we've tried to do to get immigration reform with some people on both sides of the aisle work on it has been really frustrating to me, because I think that overall it's been very good for our country, that we have been a melting pot, and it's been good for our economy. So that's one thing to keep in the back of your minds when you look at staffing in long-term care facilities. I just visited a former elected, our first woman who had a statewide office in Minnesota. She's in assisted living now, and there was no one at the front desk, no one there, no one there. I spent a good 20 minutes running around just last Friday. I did find her, luckily, but those kinds of things are being replicated and sometimes can affect care. So what else? The cost of healthcare, Medicare drug price negotiations. Financially empowering women as they age isn't just about ensuring they can save for retirement and stay comfortably in their homes. It's also about making sure they can afford their healthcare expenses, including, of course, life-saving prescription drugs. As you know, and this is something I worked on from the minute I got into the Congress, that is Medicare negotiation. I figure all these seniors can get a pretty good deal if they combine their efforts by the government negotiating better prices. But years and years ago, someone put a sweetheart deal into law that said the farmer got to have the prices they got and there'd be no negotiation for Medicare. That's why, with the large group of seniors purchasing healthcare through their Medicare, that is why it affects all of the prices of drugs throughout the nation, not just for seniors. One of the main reasons we're paying twice as much as other countries, industrialized countries, which is quite an outrage when our taxpayers have been paying for a lot of the research for the drugs. So well, here's some good news. So just this last year, you've probably heard Congress passed a new law based on my bill that has empowered Medicare to begin negotiating on behalf of consumers for lower prescription drug prices. The new law ended that sweetheart deal, and now we've got 10 blockbuster drugs that are already being negotiated. Drugs like Xarelto and Eliquis and Januvia and Jardiance. I've memorized all the names because every crowd I go into, someone's on those drugs. Well, the negotiations for lower prices are happening now on those first 10 drugs. In 2022 alone, on 10 drugs, listen to this. If you remember one number I gave you, Celinda and the other experts will have a lot more. But in 2022 alone, 9 million Medicare beneficiaries spent 3.4, this is in the US, $3.4 billion out of pocket on just those 10 drugs. That's the kind of money we're talking about. So now we're going to add more drugs for the negotiations, and the companies are suing left and right in all these courts so far. We keep going. I know we're going to win this easily. If they put the sweetheart deal into law, we have every right to change it. So that's where that is. I'm also fighting to pass legislation to double the number of drugs, to increase the number that are being negotiated on a faster pace, because no senior should be forced to choose between filling their prescriptions and filling their refrigerator. I truly believe in a future where a healthy and secure retirement is the expectation, not the exception, where we switch around those numbers I just read from your survey, so that you don't have over half the people feeling uncertain about their health retirements and worried. That's not right. So I look forward to the results of the newest survey, and we'll keep working across the aisle to build a future where every woman can thrive as she ages. Thank you for highlighting this, and I can't wait to get to work on it. Thanks, everyone.
Thank you, Senator. It was a delight to hear your reflections. It's always wonderful to hear about the leadership of your efforts regarding policy that can help ensure all women can age well. Thank you. Thank you very much for joining us.
Thanks, everyone.
Excellent. So let's go ahead and dig into our findings. So for this year's survey, we asked women both about their financial security and their health, because they're so intertwined. Your health can determine your wealth, and your wealth can determine your health. So we wanted to look at that intersection of health and wealth this year. The goal, again, was to really hear from women themselves about their concerns, their worries, and understand what policy solutions women say will help. We paid special attention again this year to low-income women. We looked at the thoughts and issues and concerns and ideas of white, Black, Hispanic, and rural women, because we know they face unique challenges when it comes to aging well in America. We asked women starting at age 25, well below retirement ages, because we know that whether a woman can age well or not starts early. And while the results are sobering, they offer a clear and bipartisan call to action. Joining us today to discuss the findings are Cindy Hounsell, President and CEO of WISER, Bill McInturff, Partner at Public Opinion Strategies, and Celinda Lake, President of Lake Research Partners. We want to hear what you're thinking as well, so please feel free to enter questions in the chat and we'll address as many as we can after we share the findings. But first, I'll pass it over to our incredible partner, Cindy Hounsell with WISER. Welcome and thank you, Cindy.
Thanks, Ramsey, and great to be here and to hear so many wonderful things from the senator. And good morning to everyone else. I'd like to say just for a minute that a lot of this has already been covered, so I'll try not to be too repetitive. It's what happens when you go third. At WISER, we've been developing financial programs and retirement materials for over 25 years to help improve the long-term financial security of women, particularly for the low and moderate income women. And so we're very appreciative that that's the audience that we've really been trying to address, the financial challenges that they face and the fact that they end up working in workplaces where have no access to retirement plans. And those are primarily low-income workers, Black and Hispanic workers, and those also working for small businesses and women more generally. So it's not surprising that, as you heard, that the survey shows that strong majorities of low-income white, Black, and Hispanic women disagree with the statement, "I consider myself to be financially secure." Over half of the respondents have not saved any money for retirement, and half are not confident that they have the information they need to plan and begin to start saving for retirement. And that number rises to 71% when we just asked the low-income women to respond. So the 48% say making decisions about retirement is complicated and confusing, and I'm sure there are millions of people out there that would agree with that. But that number also rises to 59% for low-income women. So it's clearly not easy to navigate the rules and requirements that govern the complicated systems. One of my pet peeves, that we have these complicated systems that we need to help educate women about. We depend on these two systems for our health and retirement security. And you'll hear in a few minutes from Bill and Celinda that when we ask the questions about Medicare, there's such strong there's strong support for programs that help people better understand and navigate the costs of Medicare, the coverage issues, and the plan choices. And in case you don't know the importance of getting it right, there's also a financial penalty for getting it wrong. So it's really important that women have this information and families have the information, because there's a penalty that can affect millions of retirees with higher premiums that end up lasting for as long as they live. And I'm glad to be able to insert that into the conversation. So clearly the survey illustrates support for improving knowledge and for improving the long-term stability for both Social Security and Medicare. And we're lucky to have a champion like Senator Klobuchar who's promoting those issues. So I'll stop there. Thanks, Ramsey.
Thank you, Cindy. Thank you for your remarks. Thank you for your awesome work across the country around financial education and helping real women get on track to a secure retirement. I now would like to introduce Bill McInturff with Public Opinion Strategies. And thank you, Bill, for your leadership in fielding this survey once again this year. We look forward to a walkthrough on the results. Go ahead and take it away.
Well, thank you. And I'll be joined with my Democratic partner, Celinda Lake. On behalf of Celinda and myself, we want to thank our friends at NCOA and WISER for sponsoring this survey, especially as we hear, because we too often did not have a chance to do this kind of extensive research with just women but also rural women and then low-income women as a special focus. Sil and I also want to thank our business partners, my partner Elizabeth Harrington, her partner Alicia Stell, and Hannah Stover from our team who put all this work together. So what did we do? As you've heard a lot, we did women 25 plus around the country. It's a mixed mode survey, but as well, we specialized and looked at rural women, especially as we focus on health. We know from a health policy point of view that rural voters, rural women have more trouble accessing health. They also have different health challenges, so we want to take a look at that. And then again, a survey where we looked at white and Black, African-American, Hispanic, Latina, low-income women as well. So in addition to the overall low-income women crosstab, we have these very specialized audiences. Next, the survey focuses on health, financial security. I'll cover those. Celinda will talk about the potential federal policy solutions. As you're hearing from the senators, you're hearing from our speakers, it is a chance for these women to be heard, to talk about the incredible economic stress in their life and the challenges they face. One of the, starting with health this year is a focus. Over half the women say they feel, we asked them to use a set of words. Half of them said they feel uncertain or worried when they think about how prepared they are for healthcare costs later in life. And then we are going to see what I've said in the beginning while we designed the survey, the very difficult numbers from low income and rural women as regards their access to health. These are the words that we worked on and chose for, pick 2 or 3 words that describe how you feel as it regards healthcare costs later in life. So in yellow on the right, uncertain and worried were the top 2 words. On the left, you do see a chunk of women say helpful. There are 2 columns here. One is for all women 25 plus, and then looking at the low income women. So we can tell the number of whether we picked a negative or positive word. So overall, across all women, 76% on the right hand side picked a negative word, 84% of low income women. But much like we've heard last year about retirement, that people have enormous concerns as they think about their future and they think about what's to come. Next. We used a 5-point scale to ask people to describe their health. Excellent or very good. There's a good point at the bottom in green, or fair and poor. As pollsters, we tend to look at sort of the intensity. What are the top 2 boxes? What are the bottom 2 boxes? And here this sort of again tells a story. So if you look at the excellent or good versus fair or poor, overall across all women 25 plus, that's a small positive break. But then you can see rural women are a net negative. And if you're a low income woman anywhere in any geography in the country, you are a significant negative, net negative, 41% saying that they would describe their health as fair or poor. We did 2 things. One is their kind of general health, meaning their physical, and then we asked about their self-description of their mental and their emotional health. So in general, the mental and emotional health numbers are slightly better, but we see the same trend, which is that it's a +12, excellent or very good versus fair or poor, versus a -1 if you're a rural woman, -9 if you're low income. Throughout this data, if you are any woman in the rural America, but if you are a low income woman in this country, their health, their mental health, and then all these other markers in terms of their economic stress, there's no question that economics plays a role in their self-description of health, are much worse. One of the things we tried to do in the survey is to look at what % of women would describe they're having these troubles. So this issue about health access. In the last 12 months, I've experienced delays in getting access to making appointments. 32% of the women said they've had that problem. 29% said that they have either cut the size of meals or skipped meals because there was not enough food to eat, looking at the issue of health, food insecurity. And then on the bottom, access to prescription medicines on a routine basis. These are large percentages, I have to say, and acknowledge that for me, this very high % of people describing these issues of food insecurity was an eye opener. It's not something that I would have pegged as being this high. Obviously, from the U.S. Census, we know the number of women 25 plus in the country. So we're trying to translate kind of the abstract percentages in a survey to how many millions of women are telling us that this is part of their daily life. Next.
Hey, Bill, if
yeah.
I can add, this is Celinda, if I can add to that analysis, I want to second what you said, which is, this is truly, I mean, we're supposed to be in a good economy. We're supposed to be coming out of the post-COVID era. This is an astounding level of hardship out there for women across all ages. And I would add to that, that as we talk about inflation and rising costs, healthcare costs are a major, major component of that. And neither party is talking enough about the inflation of healthcare costs to really be appealing to these women. So I think this is really dramatic data. When you think of the number of women here across the country, it's tens and tens of millions. That's astounding.
Thank you, Celinda. So this is, we're looking again at these same percentages about this applies to me, and we're looking at it by crosstabs. So we're looking at it again by all rural women, all low-income women, and then on the right, we're extending it to low-income white, Black women, or Latina women. And so this issue about food insecurity, 45% of low-income women said that they have skipped meals or cut portions because there was not enough money for food. And then you can see whether you're a white, Latina, or Black woman, if you're a low-income woman, how much that is part of their life. And then on the far right, and again, we're looking at, well, we're looking again at some of the challenges. So I find it hard or difficult to be physically active regularly. That's 45% of all women, 54% of low-income women. So you can see their description of some of the challenges in their life. Next. Okay, so another
Well,
issue.
if I can add
Sure.
just one other thing. I think if you look at the far right column, the dramatic levels among low-income Latinas is really, really astounding. I mean, you have half of low-income women who say they are facing food insecurity. That's just astounding in this country. So I think, again, we hear the dialogue. Both parties are targeting Latinas and hoping to make gains there, and yet no one is talking about something as basic as food insecurity to Latina voters.
Thank you. We also want to look at the issue of healthcare disparity. So we asked the women themselves, which is how often they believe the healthcare system treats people unfairly because of their race or ethnic background. That is a majority saying they believe that happens very often, 18%. They often, somewhat often, so a majority believe that that's a problem in our healthcare system. Then we're just showing you a little bit on the far right, where if you're a millennial, 69% say that that is built into our healthcare system, much higher than the other age brackets. And then we're comparing white women versus women of color. If you're a woman of color, that's 64%. And then we're seeing the comfortable majorities of low-income white, Black, and Latina women saying that this is what they believe about our healthcare system. Next. We also, again, focusing on the challenges of health, we asked people a series of factors, and we asked people if you think each of these factors was a positive influence, a negative influence, or not much of an influence one way or the other. And again, this in the introductory comments you heard from the senator and myself and others, the impact of being low income. 76% said if you have a low income in this country, it is a negative influence on your health. And then you can look at what they say are the other negative influences: being Black, Latina, having a high school or a lower level of education, and even fundamentally being a woman, as they see that as a negative, because they are describing in our open ends that our system is not as responsive to women and too often discount women's self-report about their health. Then we get to some of the positives, and then just on the bottom, just the opposite, which are the big factors are higher income, better education, having friend and families nearby to count on, which, by the way, from all the healthcare work we knew is true, and having a healthy diet and staying physically active. That's in contrast to they're saying, especially low-income women, they don't have the ability or time to do that. Next. Okay, financial security. I think the general theme that you're hearing is the powerful ways this data is telling us about the economic stress these women are under. Celinda made an important point. The national narrative would want to tell us that things are getting better. But in this survey data, and it's done the same way as last year, that's not the case. If anything, women are a little more likely to say it's not getting better. It's one of the major findings. And then again, the issues are quite consistent. The cost of housing, and you cannot do this research, and it certainly echoes what the senator talked about, the power of Social Security, where these women are telling us how critical Medicare and Social Security are in terms of protecting and expanding those programs. Next. When I say it's a little bit worse, we have the, have you been able to save money for retirement? Last year was 55% saying that yes, they had. It's dropped slightly to 49%, just above the confidence margin. I consider myself to be financially secure, just above the confidence margin. Total disagree is higher. And then again, same thing over and over and over again. I consider myself to be financially secure, disagreeing with that. 2/3 of rural women and almost 8 out of 10 low-income women saying that they disagree with that premise. Next.
And if I can add to that too, Bill, one of the things we know from other data is besides not being able to save for retirement, one of the things that's driving this financial insecurity is that people have used up a lot of what was in their savings and what they were able to put away during COVID. So people have decimated their savings, particularly women on their own and older women. And you now have 50% of voters who do not have $500 in savings, do not have $500 in savings. So these numbers are really, really dramatic. The other thing that we talk often about, and I really want to praise WISER and NCOA, rural women are a very, very important part of our society and not talked about very much. And look at these numbers in terms of the incredible increased economic insecurity in rural America, down 14 points in terms of how many rural women were able to save, and up 9 points in terms of disagreeing that they feel financially secure. So rural women are really, really hard hit right now, and no one's talking about it. They're invisible. One of the things that's so powerful about the NCOA data is they lift up the invisible women in our society.
What a nice line. Nicely said, Celinda. I consider myself to be financially secure. These are the numbers by white, Black, and Latina, with white and Latina women, low-income women being higher than last year, Black women being within margin of error. Next. This is something that Cindy at WISER addressed. How confident are you to have the information you need to plan and save for retirement? Again, the numbers have dropped from last year. So we're just very quickly showing any number of measures that are saying for these women, the stock market, it's not the stock market, it's not jobs. They're telling you in a day-to-day life that things are a little bit worse for them than last year. Okay, next. These are a series again of financial statements. They're running a little short, so I'm going to go through this fairly quickly. What we wanted to highlight again was the ways in which a majority of low-income women said yes, that all of these apply to them. I worry enough that I worry I will not have savings if my spouse or partner passes away. These are 70 or 80%. I don't have enough money saved for retirement. I could not take care of my loved ones. And then the way in which WISER is important in terms of what they do. Making decisions about retirement is very complicated and confusing. And then echoing what Celinda just said, I am one unexpected major crisis, illness, or injury away from a financial disaster or bankruptcy. Next. We asked people, not so much a dollar amount, but we asked them, do you have emergency funds to cover 3 months of expenses? 41% of women said yes, they did. If they didn't, we asked them if they had any money to cover any emergency expense. And this is the point. A majority of women are telling us in this survey they have zero money for any kind of unexpected emergency expense. That's 58%, with rural women rising again to almost 80% of women in low-income women. And on the far right, we're looking just women 65 plus. So they have Medicare, they have Social Security, they have benefits that other women did not have, but still 36% of women 65 plus are telling us they have no buffer if there's an unexpected sickness, job loss, or economic downturn. Next. What do these women say are their top concerns? It's incredibly stable. The cost of housing, rent, or a mortgage, Social Security, Medicare benefits being cut. Again, I think, again, Celinda, as you talk about trends we're watching, this housing cost issue is burgeoning. I just did a survey with elected officials all across the country. Their number one issue, they said, in their local area is the cost and availability of housing. But again, the centrality of Social Security and Medicare to these women and to these folks, and then the other top concerns, again, incredibly stable. Not being able to pay their household bills, not having enough money to retire, and outliving their savings. So it's very clear what their day-to-day concerns are. Next. In looking ahead about how they perceive what their retirement will be like, we ask them, they say, do you think you'll have enough to live comfortably? That's 20% of women. 16%, they'll only be able to pay their monthly bills. And then this sort of green area, which is they'll have somewhere between living comfortably and paying their monthly bills. But 24% say they don't believe they'll be able to pay their monthly bills or obligations. Again, on the far right, that's rising into the 40 and now higher 40s if you are a low-income woman, saying that your expectation about your retirement is you won't even be able to meet your basic monthly bills. Next. So with that as a setup to how they're feeling in terms of their health and their financial situation, it's a backdrop to understand their attitudes about policy, which Celinda is going to take us through.
Well, as you can tell, women are pressed against the wall, and they are worried about lots of things at once. Women are the ultimate multitaskers. We are able to worry about more than one thing at a time. And women are very, very pressed right now in terms of their economic insecurities and insecurities around finances and healthcare. But women don't want to hear just about the problems. They want to hear about the policies, and they support a number of solutions at astounding levels. Levels that actually verge on core values, not even policy debates in their minds. You want to find a bipartisan agenda in Washington? You look to women's healthcare and financial security. And women believe overwhelmingly that any three women in America can agree on more than a lot of our political institutions do. So we tested 12 federal policies aimed at helping people plan and save for retirement and their health later in life. We introduced these policies. We did not make them freebies. We did not make them unicorns or hot fudge sundaes. We said this is going to require new federal government spending or reduction in spending on other federal programs to pay for them. And you will see a tremendous level of support. If we look at the next page, these are the Medicare proposals first. First of all, as we've seen already, Medicare wildly popular policy seen as a core element of retirement, health, and financial security. And you'll see the total numbers here in the 90s. Again, this is more popular. These policies are more popular than the 4th of July. These policies are core values. They're not even policy debates. And as you can see, the red numbers, the GOP, the gray independents, and the teal Democrats, and all of those numbers, tremendous bipartisan consensus here in terms of intensity and overall level of support. And these policies are improving Medicare and Medicaid to better ensure that older adults have the option to receive care at home, expand Medicare coverage so beneficiaries have access to a full range of care for chronic diseases, strengthen Medicare efforts to help lower income older adults sign up for benefits, strengthen Medicare by adding health promotion, disease prevention programs, and increase resources to state assistance programs that provide free, independent Medicare counseling and education for older adults and their caregivers to better understand and navigate these systems. And as Cindy said, a lot of women finding these systems pretty complicated, either as they're helping their mothers or their mother-in-laws, or trying to figure it out for themselves. But again, this sea of support. In the next, and you can see bipartisan support. In the next slide, we looked at the non-Medicare proposals, and the story is the same. A sea of support across parties, levels of total support so high that these verge on core values, not even policy debates. And by the way, all of these policies significantly more popular than the politicians who oppose them. These policies include a really emerging caregiving agenda. Both women see themselves as the caregivers and also the recipients of care, and they're very worried about both ends of that equation. Providing a tax break to family caregivers to cover out of pocket, provide government assistance to lower income adults to help with basic needs. And of course, as we know from this survey, there is an astounding level of basic need. Update and modernize SSI, address the workforce issues, which Ramsey mentioned, create a new program that provides paid leave, and reduce or eliminate provide long-term care, and then reduce or eliminate the requirements that limit the amount of savings. Savings, by the way, that most women don't even have. So again, unbelievable levels of support that would be the envy of any politician, and incredible bipartisan support. What's really great about being able to do this survey over time, if we look at the next slide, is that we are able to compare the support for these policies today and a year ago. And you might think with increased tax sensitivity, et cetera, that the support for these policies would have gone down. In fact, the support for these policies increased, and the intensity increased substantially from 6 to 10 points beyond the margin of error. You'll also notice that we didn't hide the ball here. We didn't use euphemisms. We said create government programs. We said modernize and update federal supplemental security income. In there, people see a clear role for government, and that clear role for government is seen very much bipartisanly. If we look at the next slide, we asked people which of these policies were most important for them. We found people really struggled here because they frankly think all of these policies are pretty important. But the three top ones were government assistance for low-income adults, improving Medicare and Medicaid to help adults get care at home, and expanding Medicare so beneficiaries have access to the full-ranging care of treatment for serious chronic diseases. All of those have a third of the voters who pick it as a top choice. And then right behind that are workplace shortages, reducing the savings requirement, and improving access to SSI. But in general, people think all of these policies are important. And only 5%, the margin of error basically of this survey, said, I don't think any of these are important to me. What's really interesting is we've seen already there's a tremendous bipartisan consensus. We hear a lot about the generational differences. Well, not when you're talking about the caregiving agenda and help for retirement and financial security and health security. We see real support for women across generations. So these are the numbers broken out by millennials, Gen X, and baby boomers, and then Republicans, independents, and Democrats. You see a real consensus that government assistance for low-income adults is very, very popular. Often we think that helping low income isn't that popular. It's not true in the case of financial and health security, particularly for women. Improving Medicare and Medicaid, particularly popular with baby boomers and Democrats, but popular across the board. Equal support bipartisanly. Expanding Medicare for chronic diseases, very, very popular. Millennials coming on board for this. And workplace shortages, very popular for millennials as well. So this is an agenda that isn't just a seniors agenda, and it isn't just a Democratic agenda. It's a strong bipartisan agenda, and it crosses the generations. So what can we say as summary here? These women have spoken. When they're asked, they speak loudly. And that's the beauty of this survey and the ability to look at it twice. This isn't an aberration. This is a consistent finding that is getting even more deeply rooted in our society. These voters, these women voters, are the key to the election, particularly women over 50. And they're speaking very loudly about what they want as policy solutions. And these are not marginal policies. These are policies significantly more popular than anybody running for office, and policies that are almost core values in the 90s in their overall support and a strong bipartisan agenda. So these policies make a difference to the voters who will determine the election. And I'll turn it back to Ramsey to take your questions and comments.
Wonderful. Thank you, Celinda. Thank you, Bill. We're so fortunate to have this dynamic bipartisan duo helping us lift up what women have to say about what it takes to age in America. And we really appreciate your leadership, your thoughtfulness in fielding the survey and analyzing the results. It's powerful to see what women have to say. And the two big takeaways I'm hearing is women of all ages, all life stages are one crisis away, one caregiving incident, one job loss away from crisis. And regardless of generation, regardless of party affiliation, they see a role for policy to help them age well in America. So really, really sobering results, powerful results, and we appreciate your help lifting up what women have to say. But let's see what those joining the webinar have to say. I think we've got a few questions in the chat. And the first one I saw was, will the slides be available? And yes, they are available. NCOA.org/what women say. Be sure to check those out, download them, and share with others that may be interested. Another question we have, and Bill and Celinda, I welcome your thoughts on this, but I will kick it off. There was a question about different demographic groups beyond those that we elevated and why they were not identified. Asian Americans, Native Americans, and I will share that Cindy and I and our organizations are absolutely committed to lifting up what women have to say. And we recognize women are not a homogeneous block. There's a lot of variation, and we've elevated certain demographic groups this round and hope to continue to add additional demographic groups in future years. But I welcome thoughts from Cindy, Celinda, Bill in regard to the demographic groups we were able to prioritize this year.
Well, first, big thank you for NCOA and WISER, because it's very rare that Celinda and I have a chance to do this level of analysis on rural women and lower income women, and then low women across ethnicity. This just doesn't exist in almost any other research that I do. And look, Native American Asian women are part of the low income and they're part of the sample. But as generous as your funding is, to do a very extensive 200 interviews with low-income Native American women or low-income Asian American women, they're much harder to find. They're much harder to respond. That's incredibly expensive research. And so, as I said, if you're the CDC and the federal government, they have those funds. But I just want to thank your organizations, because it's very rare for people to fund as deep as you've gone into these other audiences. But there are big methodological and financial reasons why, because Native American women are about 1% of the country, Asian women are about 5 or 6. And so cutting those demos and then getting within those demos, getting a low income sample, remarkably difficult, remarkably expensive.
Thank you. Thank you. We have another question about defining low income for purposes of the survey. And I know for WISER and for NCOA in particular, it's really important to lift up the voices of women of a certain socioeconomic group. So could you define low income for our purposes?
Yes, it's a good question. If you're a single woman living alone, you had a household income of $25,000 or less. If there were 2 or more people, 2 or more adults in the household, you had a household income of less than 50,000 or less, and here's the big thing, and you said you had no money at all saved for retirement beyond Social Security, or at a max 5%. I'm sorry, $5,000. So you had, again, 25,000 or less if you're a single woman, 50,000 less household income if you have 2 adults or more in the household and children, and you had to have no savings beyond Social Security or a max of 5,000. And that's a pretty fair definition, I think, of low income. And by the way, the women just above that range would still be enormously economically stressed. These women they're serious when they talk about their income and the economic stress they're under. The women just above that who make just a little bit more and have maybe a little bit in savings, they don't have that much more in savings beyond the 5,000 or nothing. And this data is still very difficult as I describe some of the economic challenges in their life.
Thank you, Bill. Such an important group to lift up and such a consequential group when it comes to voting. So thank you. Another question that may go beyond the scope of the survey, but let's see if you have insights based on the survey, the verbatims. Is there a reason why women find it difficult to be physically active? Is there any additional insight there? Is it because they're working multiple low-paying jobs, lack of time, or is it physical health itself that prevents them from the activity? Anything from the survey?
As the only man here, I should be very careful how I answer. I might give Celinda the first crack at that to talk about it, but I know what the answer is, but from all the work I've done, but I will let Celinda address that first.
A lot of it's time, and a lot of it's time. Women are really, really overextended. And it's now people talk about their job, they talk about their side gig, they talk about their family responsibilities. And of course, family extends for women to caregiving to aunts and uncles and nieces and nephews and neighbors. There's a lot of women are in so-called flexible jobs, but it's really flexibility for the employer, not flexibility for the employee. So there's a lot of that that's hindrance. And then some of that can be expensive too. But time is the resource that women are the shortest of, and it takes time.
There's just one really easy way, just one, like, again, safe, statistic. People 35 to 55 years old, if you're a woman 35 to 55 years old, 70% plus say that they've been to a doctor in the last 3 months because either they've gone, they've taken a child, or they've taken an elderly relative. If you're a man 35 to 55, that was 21% is that I've been to a physician in the last 2 or 3 months. That 3-to-1 ratio is a powerful way to express what Celinda says, which is these women are taking care of everybody in a way that men simply in our culture do not.
Very good. Thank you. Thank you. So in addition to the policy solutions that women say can help, do you have thoughts or insights from the survey on how businesses can play a part in helping solve this crisis?
My friend Elizabeth and I, my business partner, I've done work for the Rosalind Carter Institute looking at how to support full-time workers who were also caregivers. We have not had a chance to do that for NCOA or WISER. But Celinda, I'm sure, has done work as well. Celinda, by the way, you just said it well, which is they have flexible jobs. Yeah, for them, not the employer. I think that there's a host of things employers might be able to do. But again, as a small employer myself, this is difficult to do. For major employers, this whole issue of flex time. And then information source, maybe Cindy can speak to this, but look, people turn first to their employers about where do I go to get help, information, or support, and they don't know where to go, and they turn to their HR person or their employer for help. And one thing employers could do would be just be a repository of information about programs that exist, and maybe much more extensive beyond what the company provides, because women frequently don't know where to go to get the information they need to find help.
Yeah, Ramsey, I would just add in that a lot of employers have, especially the large employers, have started these employee resource groups. ERGs. And we've done a number of caregiving sessions for those groups. And they're really just like starting a connection with people to where to find resources that all of us know everyone will need eventually.
Another thing that businesses can do, and we were part of it here in the district. We were one of the first small businesses to join the Coalition for Paid Leave. Small businesses and businesses in general can push for paid leave as a benefit to be provided, and working with government to make that feasible.
Excellent. Well, thank you all. Any closing remarks, Cindy, you'd like to share in terms of the survey results and the work ahead? Well, we're appreciative of partnering with the Women's Institute for Retirement, public opinion strategies, Lake Research to really elevate these findings together. So thank you all. Our plan and next step is to get the word out on what women have to say. So we encourage all of you to share the findings, to amplify and to share them via your social media, share them with your colleagues. If you're interested in presentations, we want to elevate the thoughts of women on what it takes to age well in America. And so we'll be getting out there to brief different policymakers and advocacy groups and consumer groups and incorporate it into some of our efforts related to helping women and older adults and caregivers ensure they age with dignity, security, and purpose. But thank you all for joining the conversation today. Thank you for joining us in elevating what women have to say. Again, you can find the research at ncoa.org/what women say. And while you're there, be sure to sign up for the NCOA newsletter so you can get our latest research and news. Thanks again. Thanks, Celinda, Bill, Cindy. Have a great rest of the day. Take care.
Thank you.
So much.